Namaste, a very good morning, and welcome to, on behalf of Canada India Foundation and all the partnering organization, a very, very warm welcome to our second session of the season 2 Ayurveda speaker series. My name is Satish Thakkar, current chair of Canada India Foundation, and I have Ritesh Malik also, who is the national convener with Canada India Foundation on this session. Friends, today's topic is very interesting, and as we all have been using aloe vera in our daily routine, and the eminent panelists we brought today on this session are from the academia, from the healthcare professional side, and from the industry, as well as from the policy making side. And the key objective is to discuss, as we are working to promote Ayurveda, it's as a preventative disease management, techniques, that how we can continue our dialogue. As we all know, in the Western part of the world, it's always evidence-based, right? So last season, the series which we undertook, almost 25 lectures, which we touched upon almost every aspect of the human health, and which then triggered that let's focus on 75 traditional Ayurvedic key medicines and discuss the pharmacological and therapeutic effect of various these herbs. So as a Canada India Foundation level, we are a policy advocacy group, and I just want to mention all the friends who have joined here and welcome them all, that Canada India Foundation is working very tirelessly for the last decade and a half in creating a very deeper understanding of India in Canada and Canada in India, and how we can foster and nurture a very deeper economic, social, cultural, and political engagement between both the countries. And healthcare has been a very key priority area for Canada India Foundation. We have hosted almost 3 various healthcare forums, and last year we hosted our healthcare forum in partnership with FICCI, along with UHN. UHN is the #1 hospital chain here in Toronto, and with over 17,000 doctors working on, and world-renowned hospital like Princess Margaret, Toronto Rehab, Toronto General, and various MOU has been actually advanced between Canada and India in the healthcare sector, and in particularly with the UHN, Canada India Foundation has played a key role. And through our last healthcare summit itself, we brought All India Institute of Ayurveda through Ministry of Ayush and UHN to create an MOU to focus on 4 core integrated techniques, integrated healthcare on chronic disease like diabetes, heart disease, kidney, and cancer. And Canada India Foundation, as a civil society, we helped create a $1 million research funding for that. And in fact, last week, we had a key meeting with the UHN. Dr. Harish Verma is one of our key champion to discuss the roadmap. And we are very proud to mention that this MOU was signed recently at the launch of the Global Research Center of the World Health Organization in the presence of Honorable Prime Minister Narendra Modi ji. So our commitment as a Canada India Foundation, we are Ayurveda enthusiasts, and you all are expert. We have a lot to learn from you, but our commitment and our role and goal is that how we can channel as an advocacy group to help Ayurveda get its own space and its own place into the Western world. And one last session was extremely well organized, and we got lot of compliments, in fact, and looking forward to today's great session. And one aspect which I would request you all, experts and eminent people from the industry, from the profession are there. I think what we should also focus on, that creating on each speaker series, on each traditional Ayurvedic medicine we are touching upon, a kind of a compendium of all the clinical studies took place in that, all the research has taken place in that, because creating that kind of a compendium of or volume of at one place, if we are talking about trifla churn or we are talking about aloe vera, what kind of studies has been conducted so far, how many research paper has been published so far all across the world. And if we can create a booklet of that down the road, and it helps us as a policy advocacy group when we are talking to the different policy makers and various other stakeholders, it goes, the volume speaks of itself. So my request to all present and the who are the part of this initiative is that we should take that as a effort that we put together on each subject which we will be touching upon, that we should create so that at the end of the series we should be able to at least produce a huge volume of on each Ayurvedic medicine we touched upon, backed by all the clinical studies has taken place, all the research paper has been written, not only in India but out of India also. So with that note, I welcome you all, and looking forward to today's exciting session. And I will invite now Dr. Harish Verma to please carry on the further proceedings of the session. Dr. Verma, over to you.
Thank you, Sriji. Thank you very much. And I'm grateful to CIF and Consulate General of India for supporting us. And the viewers, today we will have a brainstorming session on traditional Ayurvedic medicine, Kumariasava. Kumariasava is prepared from a very popular herb called aloe vera. Aloe vera, as we all know, is very popular all over the world. I was going through a report and I saw the market size of aloe vera product is around $1.6 billion. But the share of Kumariasava in that $1.6 billion is very negligible. We have two experts from Ayurveda side and two experts from industry side, and we will discuss why we have very less share in the market. What are the causes, how we can improve, and it will be a very good discussion. And for the discussion, I invite Dr. Madan Thangaveluji to moderate the session. Dr. Madan Thangaveluji, over to you. Thank you.
Harishji, namaskar. Thank you very much for having us here together on this second of our events on traditional Ayurvedic medicines. The wish, as Satishji mentioned, is to bring to the world the knowledge and information and uses of some of these traditional formulations that are known for thousands of years. And the emergency is even greater at the time when India has taken charge of a World Health Organization Global Center for Traditional Medicines in Jamnagar. So the whole world is looking to India for how we appreciate traditional medicines. And this series, with planned about 75 plus episodes, will look at a large collection of these formulations that are used safely. It's also an opportunity for all of us to learn about how these formulations came about, where they were described initially, how they are prepared, and most of all, how they are used and how safely they are used. As described by Satishji, one of the aims will be to compile all this information as we go along, so that when people like the Canada India Foundation in its interactions with Health Network in Toronto, when people ask for this information, we are able to hand it out to them readily. So our second series, last time we talked about Triphala, a very important formulation known for thousands of years, and we talked about all the how it's used, how it's prepared. Today, we are going to talk about and discuss a second formulation, which is made from aloe vera. The pulp of aloe vera is extracted and together with several herbs is fermented. And one gets a fermented product. And this has very many beneficial effects. Now, before we get this discussion started, I'm delighted to have here with us Dr. Venkat Joshi joining us from London. Venkatji, namaskar.
Namaskar, sir.
Venkatji is a very seasoned Ayurveda educationist, researcher, clinician, and based in London. Venkatji, before we get our expert speakers on, I have a simple question for you. Harishji mentioned very rightly that aloe vera is a growing product. Many things used as cosmetics, used as food additive, etc. Why is it that we see so much aloe vera here in Europe, in the UK? In any market, you can get aloe vera leaves any time of the year, and across Europe. How come we have aloe vera here in Europe, but nobody knows about the fascinating Indian preparation, number one, Kumariasava, that we're going to talk about today. Number two, why are these kind of products not popular? We are going to be talking in the episodes to come about many of these traditional medicines. Please tell us what you feel. You've been working here in Tooting in London for many years now and teaching too. Please tell us.
Namaskar, sir. Yes,
Namaste.
sir. Thank you, sir, Dr. Madan Tangavel, sir. Actually, the aloe vera, as from Ayurveda point of view, rasa pradhanyam ahara dravyam, virya pradhanyam aushadha dravyam. On the context, we have to educate people because it is the skeptical view, and then people have doubts about use any polyherbal formulations in any way because of these contaminants, whether it can be metallic contaminants or microbial contaminant, they are worried about, even if it is being prescribed. But to generate, to understand the traditional values, like Macedonia, Croatia, where we can see a lot of brews they are making. For example, the horseradish brews, to the cucumber brews, to the sour cabbage brews, to the rastrika brews, and even the grapes. A lot of our students, they are making with no preservatives. Household brews are commonly found in the Croatia, but that is not there in the case of UK, and where people are easily accepting as a food supplement for internal uses like aloe vera, which is so popular. And we have to make that aloe vera based Asava arista, which are equally safe as a food, as a medicine based, because of its synergy compatibility raised by these ingredients. And two substances, Asava aristas and leihyams, they both will come under the food as a basis supplements only from Ayurveda point of view. So understanding that, this is my observation, that why Kumariasava is not very much popular, where the aloe vera is very much popular, because, and it is the food supplement, and people have to be educated to the level of that benefits of food supplements being consumed 24 to 48 ml Ayurveda prescriptions into the dosage level, and that we need to understand and make it available, because they exploit this Asava arista. If it is Kumariasava somebody prescribed, they just take it like a teaspoonful and doesn't work. Teaspoonful, tablespoonful. You need to increase the dose, and awareness is required, as I understand. Thank you very much for giving me this opportunity.
Thank you, Joshiji. Thank you so much. You have touched on the key point, which is educating the public about some of these things and giving them enough information, which is the main reason for our set of talks here, that we want to educate people about how these formulations are prepared, what are the benefits, how they are to be used. And we are very fortunate to have with us two speakers, two experts in this area. The format for our series is that we have an expert who comes from the Ayurvedic discipline of Dravya Guna, the area that specializes in approximately the pharmacology, the pharmaco aspects of plants. And the second person that we'll have is a person who knows how to administer this and how to follow the outcome of these things. So they are the two experts. At the end of their presentations, we also are very fortunate to have with us two guests, Sri Ranjit Puranik ji joining us from Mumbai. Namaskar, Ranjit ji. And also Ranjit ji looks after, he manages one of the very large traditional Ayurvedic formulation manufacturing family concern in Mumbai, very respected organization and known across the world for their products. So Ranjit ji, thank you so much for joining us from Mumbai. We will also have, following the first two presentations, we will have we'll hear from Shri Anil Johari ji. Anil ji is very special. He was formerly the CEO of Quality Council of India, setting standards for yoga, and more recently setting standards for what are called Gram Vaidyas, the village Vaidyas, and even more recently developing approaches for quality control. And also Anilji engages in the area of trade discussions with different parts of the world. So we will hear something about standards, how things are to be manufactured, where help might be needed, either in terms of public engagement or all of those aspects, after we hear from our first two presentations. Without much ado, I invite Dr. Ghazala Hussain, joining us from Hassan in Karnataka. Ghazala, thank you so much for being with us. Ghazala is predominantly a Rasa Shastra person. She's specialized in the discipline of Ayurveda called Rasa Shastra. And she has more academic responsibilities these days. She's teaches, she's professor at the SDM Ayurveda College in Hassan. Ghazala, the floor is yours. Your presentation is with me, so I will put this up on the screen. Ghazala, please tell us very quickly, in about a few seconds, what you're going to talk to us about. Clearly, Aswam, you're going to tell us a little bit about how you prepare this and some of the, how careful we have to be with these things.
Okay. Namaste, sir. Thank you very much for a brief introduction. A very warm good morning and my salutations and greetings to all the attendees here. My greetings and my pleasure to be a part of this virtual lecture series.
Ghazala, we have lost your, please unmute, we have lost your voice. Thank you.
Sir?
Yeah, we can hear you. Thank you.
I'm Dr. Ghazala Hussain. I'm an associate professor, being into academics and teaching since 15 years. I have been a guide for PG dissertations as well. Involved in a few researches as well, sponsored by Rajiv Gandhi University of Health Sciences, Karnataka, Bangalore. My area of research interests are in toxicity and various experimental studies to know the various actions and modifications of dosage forms. The presentation that I'll be doing today is on Kumariasava. I request sir to please share the slides now.
Thank you, Ghazala. Your presentation is here. Tell me when to advance and I can advance the slides. Thank you. I hope it's visible.
Thank you very much. Kumariasava is a polyherbal preparation, and it's a hydroalcoholic preparation, what we call as Asava Arishtha. Next slide, sir, please. Ayurveda Pharmaceutics deals with various dosage forms and formulations. One such formulation is Asava and Arishtha, which can be said as hydroalcoholic preparations. Asava Arishthas are those which are obtained by fermenting the drugs in liquid medium. And in that, Asava is a fermentation that is allowed to proceed for generating alcoholic liquids and drugs kept without boiling it. in arishtas, we tend to boil, whereas in asavas, we just extract the juice and we keep for fermentation. There are 4 main constituents that are needed for any asava arishta preparations. They consist of liquid media, that is a decoction of various herbs or juice of herbs, sweetening agents, it could be jaggery, sugar, or honey, medicinal herbs or herbal powders. They will be used in the form of powders, fine powders, and fermenting agent. Most of the time we use Dhatiki Pushpa, that is the flower of Putforia fruticosa. The general method of making any asavarishta is, for fresh drugs, the juice will be extracted. In case the drug is dry, it is soaked in water overnight, and next day it will be macerated and the liquid will be filtered. And jaggery will be added to it, dissolved. It will be filtered once again to remove any physical impurities that are there in jaggery. And then the fine powders of medicinal herbs or drugs will be added to it. Then, and this is a very important step where it is kept before keeping it for fermentation, the containers or the pots that are used, containers in which we keep the drug for fermentation, gets sterilized, and it will not go for any secondary growth, etc. And then the mouth of the vessel will be sealed well, and then it will be placed in a warm room for completion of fermentation. And then once we assess the test in clean and dry containers. Next slide, please. What are the benefits of these asavarishtas or fermentation products? These preparations contain self-generated alcohol, which itself acts as a preservative, and hence they remain for a longer, the duration or the shelf life is long. The Tikshna Diguna, that is the sharp properties which are rendered because of the self-generated alcohol, helps in quick absorption and assimilation of the medicine. These asava arishtas have sweetening agents like jaggery, honey, because of which the palatability will increase, and also the jaggery, sugar, and honey that are added also have nutritive value to it. And they kindle the appetite, okay, and by stimulating the digestive enzymes. Next slide. Absolute cleanliness has to be required during the process, and then fumigation is very important. Each time the asavarishta is kept for the fermentation, the inner surface of the vessel needs to be fumigated with again herbs. And in large scale manufacturing, they use wooden vats, porcelain jars, or inert vessels, and or any earthen vessels. A place of fermentation plays a very important role for fermentation to occur properly, to maintain a uniform temperature. Usually throughout the process of fermentation, the containers are placed inside a heap of husk, wheat, paddy, or sometimes even underground, so that it is not affected by the external atmosphere. There are various tests that are said in the authentic books of pharmaceutics. To assess the completion of powders for fermentation. After completion of fermentation, these herbal powders will tend to settle down at the bottom of the container. During the fermentation, there'll be a generation of carbon dioxide, which will give this hissing sound, and effervescence will be present. But after completion of fermentation, there will be absence of hissing sound as well as effervescence. An appreciation of sour taste and alcoholic odor will be appreciated at the end of the fermentation. So by these completion of, once this is known, then we filter and it has to be kept and used for further therapeutic usage. Coming to the ingredients of Kumariasava. Kumariasava is from a very authentic book of Ayurveda pharmaceutics called as Yoga Ratnakara. This reference is from that particular book. These are the ingredients, that is aloe vera juice is taken, jaggery, and the decoction of Terminalia chebula, known as Chebulic myrobalan in English, and water will be added to it, and decoction of haritaki, that is Terminalia chebula, will be prepared. The other ingredients in Kumariasava are honey. We use Dhataki Pushpa, that is Utphoria fruticosa, for the purpose of fermentation. The other Prakshepaka dravyas, what we call other minor ingredients that we add to Kumariasava, are netmak, clove, tail pepper, muskroot, kababaka. I could not get the English this one, but the Sanskrit term is kababaka. Next slide, please. Java long pepper, erindamula or castor plant root, the nutmeg, crab's claw, Terminalia bellerica or Belleric myrobalan, orris root, and the calyx of copper and iron are added as fine powders, that is the bhasma, what we say, or the calyx of iron and copper. These are the ingredients of Kumariasava. Kumari, that is aloe vera, juice is taken, and then we make a decoction of Terminalia chibula. These are the other herbs that are made into a fine powder and then added at the time of fermentation. To the juice of aloe vera, jaggery will be added. The pot will be fumigated in an earthen pot. The drugs will be added. Madhu will be added, that is honey will be added. Utphoria fruticosa, that is Dhataki Pushpa, which is used as an agent for fermentation, will be added. The mouth will be sealed and it will be kept underground inside the pits made in the ground to facilitate the fermentation, because the ideal temperature should be between 30 to 40 degrees Celsius to facilitate fermentation. That was the classical or conventional way of making our svarishtas. At present, we use milling machines or juice extracts to extract the juice, and after that, we, instead of earthen pots, because they are very fragile, it is kept in wooden vats because they are quite thermostable and they'll maintain a good temperature. And the decoctions are made in steam jacketed vessels. And then to maintain a proper temperature regulated rooms or cellars, in those places, the drugs will be kept for fermentation. Next slide, please. Coming to the preparation of Kumariasava. So aloe vera juice will be taken, aloe vera will be taken, it will be cut into pieces, the outer skin will be removed, cleaned, and then the juice will be extracted. To this, jaggery will be added and it will be mixed. At the same time, the decoction of Terminalia chibula will be added and both these will be mixed. To this, the fine powders of the drugs that I had enlisted earlier will be added. Dhataki Pushpa, that is the Utphoria fruticosa flowers, the dry flowers of that will be added, which will help in fermentation. And then this, after it cools down, that is the temperature of the kashaya that cools down, honey will be added. Honey is added only when it is cool and not in a hot state. So after we add honey, the pot in which we keep for fermentation, that will be fumigated, and the fluid, that is the juice of aloe vera mixed with other prakshepak dravyas or fine powders, will be added and it will be kept for fermentation. Once we assess the complete test of fermentation and realize that the fermentation is complete, then it will be filtered and strained and bottled. This is a flow chart of how we prepare Kumariasava. So you have to take Kumari, clean it, extract the pulp, prepare the decoction of Dhataki, add jaggery, mix the two medias, and then the powders of the other prakshepaka, minor ingredients, the fine powders of those herbal drugs will be added. Dhataki Pushpa, that is Utphoria fruticosa, dry flowers will be added to it, and then it will be kept for fermentation. Once we assess the complete test of completion of fermentation, it will be filtered and then it will be bottled up. The general dose that is given and suggested by Ayurvedic Formulary of India for Kumariasava is 12 to 24 ml. This dose can be changed based on the condition of the patient and based on the dosha, that is the body aggravation of the bodily constituents. And usually this is given with Anupana because the pH will vary, and hence the adjuvant with which it is given is water. Important therapeutic uses of Kumariasava are: it is indicated in abdominal lump, cough, dyspnea, hemorrhoids, diseases due to the Vata dosha, epilepsy, phthisis, diseases of the abdomen, disease of neck, digestive impairment, pain in abdomen, and amenorrhea. Next slide. A word of caution with water, and hence high doses may cause gastric irritation and not to be given directly. And this has to be taken under strict medical supervision. It should not be given during pregnancy because it is a known emmenagogue. Even during lactation, only after assessment and by recommendation physician, it has to be administered. Coming to the pharmacological properties of Kumari, because there are two main ingredients here, Kumari and Haritaki, and a few Prakshepaka Dravyas. Kumari is known to have it restores the immune system. It is anti-inflammatory. It has anti-diabetic effect, anti-mutagenic effect. These are references taken from various research articles where it has proved to be useful in all these conditions, or it has these actions. Next slide. This is taken from a research article. It also has antioxidant property, antibacterial and antifungal and antiviral activity. And it is shown that it not just has antimicrobial activity, but it also helps in wound healing by its anti-inflammatory action. It also is a laxative and it is antiseptic. And because aloe vera contains 6 antiseptic agents, and they all have inhibitory actions on fungi, bacteria, and various viruses. Next slide, please. Cosmetic therapeutic effectiveness, moisturizing and anti-aging effect. It also has hypolipidemic effect. This is the reference of the article from which the following actions have been said. It's from a published article. The second main ingredient is a decoction of Terminalia, and even this has proved to have immunosuppressive. It has cardioprotective action, anti-ulcerogenic, anti-arthritic activity, anti-mutagenic, antiviral activity, and also it has radioprotective activity as well. The Prakshepaka, the other herbs that are added as Prakshepaka Dravyas, like ginger, long pepper, and others, also have proved to have free radical activity, anti-inflammatory, antimicrobial, and antioxidant activities, to just name a few. Pharmacological action of Kumariasava. Kumariasava is said to be hepatoprotective, and it is a digestive stimulant as well. In digestion, it mainly affects the liver by causing stimulation, the release of bile from the liver, and improving the liver functions. This action is attributed to the presence of aloe vera and the calyx of copper. The research update says that Kumariasava lowered the increased level of these enzymes where it was able to reverse the liver damage. And this similarly reversal of hypoalbuminemia by Kumariasava was also seen. The Kumariasava also reduced, and there was it was able to interfere with the oxidative damage and anti-lipid peroxide property. And it also stabilized the plasma membrane, leading to reduced extent of lipid peroxidation. And results of biochemical estimations were supported along with the histopathological examination. It has also proved to have antioxidant property. In vitro antioxidant property of Kumariasava was evaluated, where it had shown scavenging, hydrogen peroxide scavenging and total reducing power. And the results were compared with standard antioxidant ascorbic acid. So this formulation did show a marked in vitro antioxidant property. Even the other ingredients, the minor ingredients which are added during fermentation, like Jatamamsi, Piperchibia, clove, etc., they also contribute to the antioxidant effect. Jaggery, which is added as a sweetening agent, Utphodia fruticosa, that is added as a fermenting agent activity due to the presence of phenolic compounds in it. And the other medicinal plants also contain phenolic acids compounds which are responsible for the different kinds of biological effects, including antioxidant activity. Next slide, please. To conclude, formulations that are hydroalcoholic preparations, or the Asava arishtas, are considered as one among the finest formulations of Ayurveda pharmaceutics, owing to the preservative effect that they have, and leading to a longer shelf life of Asava arishtas. Kumariasava is an Ayurvedic formulation which is prepared with mainly aloe vera juice, jaggery, and soaking of various herbal drugs for a certain period of time and kept for fermentation for the fermentation to occur. Thereby, it comes out as a hydroalcoholic preparation. Though the process of fermentation, through the process of fermentation, alcohol is produced, which facilitates the extraction of active constituents present in the drugs. Kumariasava is a polyherbal formulation. It has wide pharmacological actions and hence used in various disorders. Is from Ayurvedic Formulary of India, and this reference was from Yoga Ratnakar as well. And the other are research articles which have proved to have various pharmacological actions. Thank you all.
Gisela, thank you so much for enlightening us about this very, very important preparation, but one that is not recognized, both my understanding is in India and elsewhere. Now, a small question before we move on to our next speaker, Dr. Bhatt. The question is that your college, you have a pharmacy in your college in Hassan. When you prepare these kind of preparations, either for demonstration to students or for use in your hospital there, do you have large batches that you prepare? Are there some difficulties with the quality of these things, or how do you do? I know for small batches, it is much easier to manage compared to when you go into the manufacturing area and you want very, very large batches into hundreds of thousands of liters. Tell us a little bit about your experience there in STM Hassan, a very, very important educational institution in India.
Smaller batches, preparation of smaller batches is very easy because you'll be able to maintain the temperature very well. It will. We use the conventional method of preparation of Asava arishtas. So we fumigate the pots to sterilize it. And after we prepare, we keep it for fermentation in a heap of husk of most of the time of paddy till the fermentation is complete, and then we'll filter. The same when we make in liters together, say 20 or 30 liters of Asava arishtas, it is very difficult for us to keep the barrels inside a heap of husk to maintain the temperature, because temperature is very crucial. Only when it is between 30 to 40 degrees Celsius that the fermentation can occur well and will get the desired properties to the Asava arishta. If the temperature goes below 30, fermentation itself will not start. And in case it reaches above 40, even then the enzymes will lose their structure, and even then the Asava arishta will not come out well. And so a very good setup for preparation of Hasarishta is needed, especially in regulating the temperature and maintaining a very sterile environment so that it doesn't go for secondary fermentation.
Ghazala, thank you so much. You have brought us to that key point about scaling up production, maintaining quality. And we are so fortunate, as said, we have Shri Ranjit Puranik ji here with us, who has a lot of experience in the industry side. And also in terms of quality control, we have experts from the Anil Johri ji. We will come to our two special guests later in the presentation and get some ideas about how they would guide us and how they can visualize a new future for these traditional Ayurvedic medicines, not only for India, but for the whole world. Thank you, Ghazala. Thank you very much for introducing us to this very rich and important formulation. I take this opportunity to invite our second expert, Dr. Gayatri Bhatt. Gayatri ji, namaskar.
Namaste, sir. Namaste all.
Thank you so much for joining us today from Karnataka. We look forward to your presentation, Gayatri ji. Your presentation is here with me. And while I load this up, please tell us a little bit about how you came into Ayurveda and how you continue to be inspired about this wonderful science of Ayurveda, and what is on your mind for globalizing this important science, particularly the traditional Ayurvedic medicines. Thank you. I'll just prepare your slides in the meanwhile.
Thank you, Tangavelu sir. I have met you in Gujarat World Ayurveda Congress.
That's right.
And yes, my grandma was an traditional healer, and I had that affinity towards healing. So after my 12th, I found fascinated. I became fascinated towards Ayurveda because I belong to a very remote village in the coastal Karnataka, where every day we use herb for food as a food, and we heal ourselves with all those available the herbs around us. So I completed my undergraduate at Mysore Ayurveda College and postgraduate in SDM Udupi. And since 22 years, I am working in SDM Ayurveda Hospital, Hassan, as a Prasuti specialist. And I treat a good number of gynecological disorders, and I am specialist in Garbhini Paricharya as well as infertility treatment. And we do Garbhadana Samskara, and we do this. I am also very much interested in taking this Ayurveda in a global level. And I was a faculty in Mayur Ayurveda the college, headed by warriors 2007 and 7, 8, 8, 9. And I used to teach their clinical methods, Prasuti, Kaumarabrita and Draviguna. And I'm being the faculty of overseas teaching cell in SDM College of Ayurveda since then. So my area of interest is infertility, that too polycystic ovarian disease and menstrual abnormalities, and antenatal care in prevention of pregnancy related complications, both fetal and maternal, as well promotion of normal labor, and postnatal care for the promotion of lactation, as well promotion of maternal health, and to prevent the maternal and fetal mortality and morbidity. So I'm very grateful to Dr. Harish Verma, who contacted me for this the opportunity, and I'm very happy that I'm sharing the platform with the Puranik sir and Tangavelu sir. You have many platforms. I've seen you and I have heard your talks, and I'm very lucky to be here today. And I was asked to discuss about the therapeutic use, taking as Ghazala madam has taken all the references, has presented the references. Taking those research references only, I have tried to discuss the therapeutic use of Kumariasava. And all of can you please next first slide, please? And as it is a multi-herbal formulation, and it's a Kashtaushadhi, and it doesn't have any minerals, right? Direct minerals, like it is not a Rasaushadhis. And many clinicians are happy to use this Kumariasava in our clinical practice. Can you please change the slide? Yeah. Kumariasava, when we are using all the whole drugs here, but when the researchers have found many more than 75 active constituents in Kumariasava, the drugs in the Kumariasava, their antioxidants, enzymes, minerals. Next, please. Sugars, hormones, fatty acids, and amino acids, essential amino acids. And maybe we can understand how our these drugs are helping in treating many the clinical ailments based on the active ingredient, their mode of action. We can make the global market to understand how this Kumariasava is helpful, because as you were telling that aloe vera juice and aloe vera gel is in the market and attracting good number of millions of public, and gaining the more the financial support also, but not our Kumariasava, just because maybe it is the preparation method and the palatable, and also maybe being Ayurvedic physician, we are not reaching the public with the or the global market with the documentation, where we are failing in documentation of a clinical outcomes maybe. So we use this Kumariasava with amino modulator property, digestive, anabolic, aphrodisiac, hepatoprotective stimulant action, as well as anti-inflammatory action. And in digestive system, it helps in because it is having Ushna and Tikshna Guna properties, and it helps correcting the indigestion and flatulence, bloating, abdomen, and it also corrects the anorexia. And it is a good, that we can say it helps in treating peptic ulcer or the GRD, because these, previous please, these conditions are mainly due to the problem in Agni, that Agni. So whenever we are using this, there will be mild laxative action that we call as anuloman action, as well as this, what you call the corrosive action of this pepsin, as well as gastric juice will be neutralizes by the Tikta Rasa and the Shita Virya of the drugs which are there in the Kumariasava. And hence that reflux action also can be come down, can bring down, and thereby we can treat even this other Urdhvaga Amla Pitta. So next, please. So it also found to have a hepatoprotective action, as Madam very well said. And this Kumariasava can be used even in any type of like a hemolytic jaundice as well hepatic jaundice, and also in a clinically KC professionals are using this for treating these conditions, and also even with cirrhosis of liver or the what you call it, the Ekrit Roga as well as Pliha Vruddhi. In such conditions also Kumariasava is being utilized, because it is Agnisthana. So when Agni is impaired, Pachaka Agni, so when Kumariasava is administered, and that's in a proper time, and with the other diet modification, lifestyle modification, we are able to treat the cirrhosis of liver also. And for anemia condition, Panduroga, along with the Punarnava Mandura or Loha Basma and Abraka Basma also will be helpful. Here the Kumariasava can be used as adjuvant or the Anupana. Then sometimes there will be the hair fall in the hepatic disorders. While it is one observation that when we are treating this hepatitis, that jaundice with Kumariasava, even with without any other application, external application, with regular oil using also, the hair fall was under control. So we can say that even hair fall can also be treated with Kumariasava. Maybe because it corrects the Agni, so Rasadhatu it becomes Nirama, and Uttarotar Dhatu Poshana happens. Thereby Asti Mala, that is hair, also will be formed normally. Next, please. Then laxative action. So because of the anthraquinones, these are having that laxative action. So it can be used as Nitya Virechana. Wherever we feel that Pitta, and even in the Pitta Prakriti person, and when Pitta Vikaras, as a daily laxative, purgative, the formula we can use this Kumariasava. So it relieves constipation, hemorrhoids, hyperacidity, and bloating abdomen. So when we say that reproductive system in female is in Apanasthana, that is the pelvic region is the Apanasthana. So Apana Vaigunya is happened with aggravation of Apana, that is the Vibandha. So it is our clinical observation that while taking the history, we see that most of the lady with the reproductive health issues like menstrual abnormalities, majority of them are having constipation or irregular bowel habits. So there, when we are giving, the Kumariasava, it is helping in correcting the menstrual irregularities also. Maybe it is by correcting the constipation or the Vibandha. Next, please. So for skin, of course, we know that aloe vera gel are being used for external application. And even in our practice also, in our hospital, we conduct 40 to 50 deliveries. Max 60% of normal vaginal delivery we conduct, and out of them, whoever having episiotomy, we applied aloe vera gel with the Haridra Churna and Darihadra Churna. Apart from that, other skin diseases like dermatitis or fungal infection, even with the vaginal candidiasis also, whenever the lady complained of leukorrhea along with vulval infection, vulval itching and all, when we administered along with the local wash, like douching along with the other kashayas, when we are giving Kumariasava internally, we are getting better result even in the controlling the vaginal itching. So even eczema, especially I have treated one lady with the genital area eczema. So it had given very good result while taken internally. So even one of patient had herpes simplex and repeated infection. She had gone to skin specialist for antiviral treatment, but when it was recurrent, she came to us. When it was seen, all the genital herpes was there. Then we gave her, because no point in giving modern antiviral, already she had taken. So we admitted her, gave her one Virechana. Along with that, after Virechana, we gave her Kumariasava and external application aloe vera gel. And it's almost 1.5 to 2 years. The lady is, she comes to us for other ailments, but there is no herpes. Even we have sent that secretion for HP also to know the causative factor, the culture, HP and all found herpes. And after the treatment, it was cleared. So we can use it for even the psoriasis also. So as anabolic, that Brahmana, because it is found to have micronutrients like vitamin A, beta carotene, vitamin B12, vitamin E, vitamin C, such even the folic acid also it has. So it can be used as rejuvenative, anti-aging, or we can say the rasayana, right? So even this Kumariasava is having the Haritaki, Amalaki, Pippali. So this Pippali, we know that it is immunomodulator, and it has more than 159 chemical constituents. The proteins were extracted and are found in the Pippali. So with the Kumariasava, with this type of the drugs in it, so having all these kind of anabolic activities. So wherever Brahmana therapy is needed, in Kshatakshina or in such cases, wherever the Agni is affected, Mandagni is there, we can use this. So with this, I can say that in sometimes we get ladies with menstrual abnormalities, and they will be normal bit or the lean. And in there also we observe the Rasakshaya Lakshanas. So whenever Rasakshaya is there, there will be Shosha will be there. Rase Rauksham Shramma Shosha. So Raukshata and Shosha. When Rauksha Guna, Raukshata and Shosha is happens in the endometrial cavity or the female reproductive system, there in the scanty bleeding or irregular menstruation, even it may cause amenorrhea, like just like Asherman syndrome. So in such cases, we have to clear the Agni. So we can use Kumariasava, and thereby when it is used for a longer duration, and it will give a rasa pushti, and by that Uttarottara Dhatu Poshana, and giving the Brahmana or the Santarpana effect. Next, coming to reproductive system. So we all know that menstrual phase is what our menstrual phase is governed by Vata. Vata helps in the expulsion of collected 28 days. Masoeno pachitam kale damani bhyam tadartamam. Throughout the month, the collection of this artava or the blood is there in the endometrium. Endometrium proliferative will be there, proliferation that will brings out by Vata in the normal condition when Vata is balanced. So there should not be any pain. That all the three doshas, Vata, Pitta, Kapha, should be balanced, so that no itching, no clots. So the blood also should not be too heavy and too less. So that's a normal. When there is aggravation or the Vata Vriddhi or Vata Kshaya in both conditions. So in Visheshan of Vata dosha, there comes the clinical conditions like amenorrhea or irregular menstruation, scanty bleeding, heavy bleeding or with clots, and dysmenorrhea. This type of problem. Here, heavy bleeding not due to the Pitta Vriddhi. Here it is heavy bleeding due to the Chala Guna of Vata. It is polymenorrhea, we can say long duration of bleeding. That's also DUB here. So polymenorrhea. So bleeding an amount may not be more, but the duration is more. So in such cases, when we are using the Kumariasava, so it controls the Vata, and Vata, though it is Pittakara due to Pitta Rasa and Kashaya, the Pitta Rasa and Shita Virya, it will contract and it will have the Stambhana. So normal amount of bleeding for the normal duration will happen. And also it has previous, please. Sorry, am I taking more time?
No, please continue.
Okay. Is that okay?
Yep, please.
Okay. So as also it is found that it has the drugs here are having anti-inflammatory property, especially aloe vera. So we know that during the menstruation there will be PGE2 secretion, and it is from the research is found that the ladies who are having dysmenorrhea, especially primary dysmenorrhea, are having more PGE2 prostaglandins, which are responsible for the inflammation. They are causing the pelvic congestion, as well as due to that the pelvic pain, so low back pain or lower abdomen pain, painful menstruation will be there. So when Kumariasava is used along with Rajapravartini Vati, it is helping the clinician to treat the dysmenorrhea. Next, please. So in coming to next phase is proliferative phase, which is governed by Kapha. So during this, there will be regeneration of cutting, the lost endometrial vessels, trauma and all. So the progesterone hormone or the Kapha helps in the regeneration, and folliculogenesis also happens in the ovaries during this period, which promotes the ovulation. So if this phase is Kapha vitiation is there, then the clinical conditions like reduced proliferation of endometrium and defective folliculogenesis leading to anovulation, especially in polycystic ovarian syndrome, which leads to infertility. Such conditions are there. So also these are happening even due to, we know that polycystic ovarian disease is one metabolic disturbance conditions, And we also know that menstrual physiology is directly related to lifestyle and diet and lifestyle. Due to defective, due to stress or the faulty food habits and the lifestyle, a faulty lifestyle, there will be free radicals in the body circulating throughout the body, and this leads to defective estrogen metabolism in the liver also. So this Kumariasava, the drugs in the Kumariasava are found to have antioxidant property, and this will correct the free radicals. They prevent the free radical, thereby correcting the tissue functions. And because it is a Yakrit Uttejaka, it works on directly on a liver, and it corrects the liver function, or it stimulate the liver. So it is helpful in correcting the defective estrogen metabolism which is in the liver, thereby correcting the menstrual abnormalities. Next, please. Then secretory phase, which is governed by Pitta. During this phase, we know that female hormones are steroidal hormones are secreted, and corpus luteum is formed immediately after the ovulation. And if fertilization happens, this corpus luteum is helping the embryo to for the further maturation or the development. And if fertilization is not there, corpus luteum will be degenerate, that the progesterone support to the endometrium is lost, thereby there will be end withdrawal bleeding or causing the menstruation. So any defect is here, then clinical conditions like luteal phase defect. That means here, if the Ushna Guna of Pitta and the Tikshna Guna Pitta is affected by more Kapha or the Somya Bhava, that means due to Divasapna or Abhishandhyaharas, or maybe due to obesity and all, and this there will be luteal phase defect, which is leading to the decreased progesterone in the serum. So whenever if the fertilization happens also due to the luteal phase defect, there is no support for the support of progesterone, before the lady miss her periods, before implantation, she will lose the zygote. So that one condition called Vamini Yonimapath. So, and also because there won't be any, further metabolism, tissue metabolism, cellular metabolism is affected there. So there won't be much growth in the endometrium. Endometrial proliferation is also affected, though there will be thin endometrium. Endometrium thickness will be very low. So it leads to, in chronic conditions, irregular menstruation or longer interval, 1 to 2 months, 3 months, like that, lady may get the period. In this condition, when we use Kumariasava, so it helps to correcting this phase by phytoestrogen activities, and because which promotes the embryo growth by the folic acid in it. So then coming to menopause, we know that a whole world, they celebrate the menarche, and menopause is already always will be people think that it is the end of life. So if we use wisely this Kumariasava, because it contains phytoestrogen in it, so we know that for menopause, the HRT, hormone replacement therapy, along with the patches, injections, or the tablets are used in the market. But whether these herbs can be can substitute this HRT, means we can see if wisely, if we are used along with other Shodhana therapies, detoxification and methods, then I can say yes, we can, because these drugs of Kumariasava are having phytoestrogen property, and we know phytoestrogens are having adaptogenic quality. Whenever there is hypoestrogen is there, they can supply the estrogens, and they are adaptogen in compare with the synthetic estrogen, which are not adaptogen. Whenever there is hyperestrogen, they can remove the the extra or they can block, just like lock and key method. They will block the receptors of estrogen in the tissues, thereby blocking the bringing the hyperestrogen put down. So this is the condition where the ladies will be having hot flashes, irritability, and impaired lipid metabolism. So when Kumariasava is used, this type of hot flashes can be combated by the phytoestrogen activities, and also because it has got pippali in it, amalaki and haritaki also, irritability type of complaints also can be under control. And we know that estrogen hormone is needed for the lipid metabolism, and in menopause lady estrogen is deficient, hence there will be impaired lipid metabolism, so leading to collection of fat, and or you can say the obesity, and also even they are at risk of cardiac arrest. So when Kumariasava is used, we can treat all these conditions. Then it is because it stimulates the drugs in it having the immunomodulator, the activities, it can even prevent the antiviral. So sorry, it can prevent viral infections. Next, please. So coming to anti-cancer, so because it has polysaccharides prevent the anti-cancer, I have the experience with this property of Kumariasava. Actually, that lady, actually, I told her she had endometrial carcinoma, and which was her age was 65 years, and they were not ready for chemo or radiotherapy, and they thought Ayurveda can do help them, and they brought her to me. And I after giving a mild sadhya virechana to her, and I have prescribed her Kumariasava. In the beginning, they were reluctant to take. They said they will take fresh juice of aloe vera because they have in their garden. So she started taking that. After 1 week, they come back to me and said that she is getting little irritation, gastric irritation. Then I said, okay, you with the Kumariasava, it may not be there. So then she started taking Kumariasava, 15 ml twice daily with the equal water. And we found after 1 year, once in 6 months, used to go for the checkup, and there was no metastasis. Almost 2 years she took this treatment, and now also she is fine. Another is my own home and the maid in my village. She's also had endometrial carcinoma, and she was actually treated with radiotherapy and chemotherapy after hysterectomy, after hysterectomy. But I have told since 1.5 years now, she is taking fresh juice of aloe vera, and also it is helping her, preventing the metastasis. And next, please, if already discussed. Next, please. Next, please. So we get because it is laxative and it is immunomodulator. Whether we can, it is Brahmana, whether we have a doubt whether it can be used in pregnancy. But the answer we know that it is not recommended during pregnancy because of its Tikshna and Ushna Guna. It is purgative, and that too early pregnancy should not be used because the drugs in it are having anti-fertility action also. So it may abort. So, and the ailments during pregnancy, they won't need any Kumariasava. Next, please. Next, coming to lactation, whether lactating mother can take this. If lactating mother is there is no direct contraindication, though there is no safety study also. But the medicines which are included, that herbs which are included here, are not having any negative effect because all are having immunomodulatory effect, and there is not much side effect are reported in a clinical practice. Lactation mother, if she is in need, can be used because jaundice, hepatitis, if she is suffering from jaundice, or if she is suffering from anemia, which is very common, common problem in Sutika Pandu, along with Punarnavasava or Abhraka and Lohabasma, we can use Kumariasava with the as Anupana. And another thing is during lactation, if the mother fetus is, baby is having, neonate is having neonatal jaundice, Then if mother is given Kumariasava, maybe the fetus, the baby maybe may get recover soon or more earlier with this neonatal jaundice. Next, please. So before I I want to conclude saying that these whatever Ayurveda formulations are having, we are we are prescribing, or we know that they are tested, trusted, and documented. But in a modern era, we are just looking or we are concentrating on a number of patients, and maybe we are not able to document. But we have to with the modern system, or the medical scientist, we have to do some research with the clinical outcome, and we have to document so that we can say that this Kumariasava will be helpful in many treating many clinical conditions. I thank the organizers for giving me opportunity. I hope I met your need. Thank you.
Gayatri ji, thank you so much. Your presentation was filled with such amazing details. Thank you for sharing so much with us.
Yeah,
You have taken us.
I included 2 case studies. Shall I tell 2
I don't know how we are for time, Gayatri ji, but let us keep.
Okay,
let us keep this for. Let's keep this for our discussion. What I found very exciting, I want to put this in the context of the discussions that are going on between Canada-India Foundation and Health Network, the group that Satish ji mentioned as we started. What I found very exciting here is your explanation of possibly the use as a mild laxative for managing all the apanavayu problems that they're as antiviral, as a vaginal douche for so many aspects of women's health. And also what you are talking about, the adaptogenic properties of this herb and formulation, and how you can use this for guna-based chikitsa. You have taken us into the depths. Many people watching this may not be able to grasp all those fine details, those elegant details that is there for specialists like yourself. And before we move on to the questions, answers, and the discussion section, I want to leave you with one question. We have heard about this formulation, the second in our series of traditional Ayurvedic medicines. And we started off by saying that there is a huge interest in aloe vera juice, and not much is known in the world outside India, or maybe also in India, about this amazing fermented formulation. So very little is known about this. There is an opportunity here to take that one aspect that you had, which is women's health, and that in itself, using just one formulation, which is Kumariasava, can become the basis of a very elaborate interaction between Canada and India in the area of women's health. Do you think this is something that can be considered for the future?
Yes, sir, definitely, because Kumari itself says that it is a name of woman. So it cures the problems of woman. That too, Kumar is like adolescent, we can say. So it cures the problems of adolescents. So definitely with the Kumariasava, we can have actually research outcome based discussion in future. Definitely we have to document. But only thing is, whatever we are treating. As I said, we treated a good number of polycystic ovarian death to adolescent. The unmarried or the there or men for infertility also. We have given the Kumariasava, but after Shodhana, that is a detoxification. Most of the cases we give after the detoxification. It gives more and good results. But of course, without that also, Kumariasava is giving result when we are using it wisely, considering that time of time. I mean the time of what to say, medicine taking time and administration time. Like upon our time we say na, or the before food, after food, like that. Another thing is we have to use the body, consider the body type where we are using this, and
Thank
also
you.
we have to think of age. Thank you. Then definitely we have a good, we can have a good the interaction with this.
Gayatriji, thank you so much, because you have given us the ways in which you can use this formulation, a simple formulation, a very old formulation, a very important formulation, and how it can be used. And you've given us many attributes of the formulation, and most importantly, this aspect about women's health. I think this is one area where we might be able to develop a very extensive research collaboration or a clinical collaboration between. And Harishji is here in Canada. He's here, he's guiding us together with Canada India Foundation. So we will be able to discuss this. So wonderful to hear all of these things. We are very fortunate to have here with us Shri Narendranji, who is going to just give us a few thoughts. Narendranji, namaskar.
Namaskar.
Namaskar ji. Thank you so much. You are joining us today from New Delhi. Thank you so much for being with us today. And I hope you heard from our two experts on how a very simple formulation can actually open up global interactions. Women's health problems are global problems. And such a simple formulation can have huge benefits. So from where I am sitting, I see immense global opportunities on this one simple formulation. We have many more of these formulations being discussed, but please, we want to hear from you.
Excellent, Dr. Madan and Canada India Foundation and Dr. Harishji. Thank you for inviting me. So I'm personally learning a lot, and I constantly keep thinking about how we can add value, how we can bring this to a global narrative. And a quick thought, I was responding to Dr. Madanji's question on this Kumariasava in terms of women's health, etc., etc. I recently had on another discussion. There is a person from Karnataka who's written a book on Ritu Vidya. Mm-hmm. This is about women's menstrual health. Mm-hmm. And that book has become world famous, and she's been invited to many platforms across the world to talk about our knowledge system and our understanding of menstrual health. So this is an essential, important discussion alongside when we talk about Ritu Vidya and how our forefathers understood this, and combine that with Kumariasava and how we treat some of the malignants and disharmony around the menstrual health becomes a very important discussion. I think it is our duty, which we belong to this great nation, to put forth this. And the world is currently struggling on the soft side of feminism to stress-related menstrual hygiene issues, and these are all very important aspects which is greatly in public discourse. So I leave it to the organizers of this and Canada India Foundation to see how we can create a unified narrative to address. The issues are very global in nature. I think the world doesn't look for different points of view, looking for answers, looking for understanding this from multiple point of view. I think it's only our duty to bring this to the forefront of a global discourse. So that's my reaction. Thanks.
Thank you so much. Thank you for mentioning about this book, Ritu Vidya, Ancient Science Behind Menstrual Practices. I've located it. It's on the chat box. Unfortunately, viewers on Facebook and on YouTube Live. The book is titled Ritu Vidya, Ancient Sciences Behind Menstrual Practice. And the book is by the author
Sinu
of the book
Joseph.
is Sinu Joseph. That's right, by Sinu Joseph. Thank you so much for sharing, for pointing us to this. And sometimes it is in these important narratives that we can find the energy and the harmony for growing our ancient science and taking it forward. Thank you so much for adding this little bit to the. We are so fortunate that we are to have Ranjit ji, Puranik ji here with us, and also Anil Johari ji. Let us see if we can gather some comments from both of them about this discussion and thoughts they have on their mind, like what you have offered us, sir. Anil ji, namaskar ji.
Namaskar.
Anil ji, pranam. Thank you so much for staying with us.
Everybody, I guess.
I hope you have been busy traveling to Germany and elsewhere. It is such a delight
I'm back in
to have
India.
you here with us. Anilji, the question is, we are playing with ideas. We've heard our wish for looking at traditional Ayurvedic medicines for the future, formulations that are there with us for thousands of years. How do we assess the quality control? How can we use the Ayush mark to further these products? How can we use this in ongoing interactions between countries? And where do we position ourselves? Some of the things that you are very comfortable with thinking through, and taking this instance, just one example of Kumariasava, and one of the many areas which is women's health. Is there something that we can build on for the future?
Yes, actually, I'm glad to see Ranjit also here, old friend, and he knows all about this Ayush mark, because he was on the industry side when we developed the scheme in 2009. So when we developed the scheme, one of the ideas was that how do we address the concerns about quality of Ayurvedic medicines, especially in the West, relating to contaminants and heavy metals, etc. Apart from the fact that we wanted to assure quality even in the domestic market. So therefore, we ended up having two levels of certification, the Ayush standard mark and the Ayush premium mark. Standard mark being the one which required compliance to domestic regulations. And the premium mark was one which required compliance to WHO GMP. Plus contaminants also. There were limits of contaminants. The government had already issued a notification in 2005 that testing is necessary for heavy metals and 3 or 4 arsenic, lead, mercury, I think. Therefore, contaminants. So we created that Ayush premium mark with an eye on the overseas market. We also said that it could be also compliance to importing countries' regulations, provided they are more stringent than option A. Option A was WHO GMP and contaminants as prescribed. Plus, I think something which people don't realize, Ayush premium mark is only applicable to herbal products and not to metal-based products anyway. The reason was very simple. We had a WHO GMP for herbal products. We do not have a WHO GMP for metal products. So in fact, the thought at that time was that at some point of time, we will create an equivalent of a WHO GMP for metal products, but which has not happened, frankly. So this is how it is. Now, the idea, it takes a long time in India to get anything going, actually, unfortunately. But finally, Department of Commerce has come around to the view that they need to negotiate about Ayush medicines. Now, one problem which I see is that Ayush medicines have been exported for years now as food supplements and not as medicines. But now, Department of Commerce has come around to the view that they need to negotiate access for Ayush medicines as medicines if we have to promote Ayurveda worldwide. And a text has been made. I have been part of I'm still, although I've retired, I'm still part of certain committees, and especially in commerce. And the first target was actually UK, the negotiations with UK, to present Ayush Premium Mark as a demonstration of compliance to UK regulations. I mean, I have been arguing for quite some time with that. There are, we need to ask simple questions, frankly. I don't know why it's so difficult sometimes to understand. A, is our product, and it applies across to all products, is first, is our product as regulated in India acceptable in global market? So answer is no, as far as Ayush is concerned. I mean, it will fail on the WHO GMP front itself, because we have Schedule T, which is probably much less stringent than WHO GMP. In case of pharma products, another question that we need to ask is WHO GMP certificate issued by CDSCO, the regulator here, or the COPP, is that acceptable in global market? When I talk to the industry or talk to the Ayurvedic experts here, they tell me, I'm not an expert, you know that. I'm not from Ayurveda field. They tell me, well, in some countries it is acceptable if you produce a COPP or WHO GMP, but in many countries it is not, especially Canada, EU, UK, USA, Australia. I mean, all the major places where we are targeting. If you look at the Government of India's current priority, they are negotiating or starting negotiations with Canada, UK, EU, and Australia. So then the next question is, if these are not acceptable as regulated and as certified WHO GMP or COPP, then do we need an alternate mechanism which can meet the global expectations? This is a question I always answered and said, yes, we need an alternate mechanism. Rather than individual exporters going to the overseas regulator by regulator. You go to UK, then you go to Canada, then you go to Australia, get your product approved, follow their process, get their product approved. It would be much simpler if we have a system here which addresses global requirements. And that certified manufacturer is accepted in some way by the overseas regulators. So it's much more cost effective. It's a harder option, all right. It's a more difficult option, but then it's more cost effective in the long run. So now at least I know there's a text now for negotiation which has been prepared, which should be, I don't know whether it has already been presented to UK or it is yet to be presented.
Is this, Anilji, is this text in the public domain or is it still within?
No, it's within the government as of
within
today.
government.
Yeah,
I want, Anilji, I would like, hold on to that one important point. And the question is, we have traditional Ayurvedic medicines, which are known for thousands of years. We have heard today how they are manufactured, how they are produced in India in small scale. And we've heard from our first speaker about the challenges. We've heard from Gayatri ji about how effective they are and how effective they can be for global problems and effectively for women's health, which are high value markets. So if I take your point and just pass it over to Puranik ji, just to say, is India missing an opportunity here, Ranjit ji, that the world is moving along, they are happy to, accept all of these exciting possibilities. We are sitting on this knowledge. There is nothing that is going to stop somebody in Mexico making Kumariasava tomorrow. Somebody is going to be listening to this presentation and say, oh my God, I have all the procedures required, steel fermenters, 10,000 liter, a day fermenter, I can produce this. Is India missing a chance? And are we as industry, as government, as the community, are we missing a chance? So that is the thrust. I will let you elaborate in whichever way you would like, whether it is in terms of awareness, whether it is in terms of research, whether it is in terms of standards, whether it's, whichever way you would like to. We would love to hear you because you are one of our respected industry representatives in many of these discussions. Thank you, sir.
Thank you, Dr. Madan, and greetings to everyone who's come out here. And it's a pleasure seeing Anil Johri once again. And I have a little different take in most of these discussions. And most of these discussions tend to talk about one herb or one product, and we go into detail as to what the ancient treatise has said about it. And we also go on to, support it with a lot of scientific papers. And yes, it all seems good. The GMPs, the quality assurance guidelines can all be monographed. The GMP SOPs can also be put into infrastructure and taken ahead. But everything, Dr. Madan and friends, it all boils down to your label, which is on the product. First, is it an external application or is it meant for ingestion? If it's meant for ingestion, there's a whole lot of stringency that opens up. And then it comes down to what for is it going to be used, your claim statement. If you reflect on the presentations that we've had, the first two presentations, Dr. Ghazala and Dr. Gayatri have very vividly and through their own experience also as clinicians, talked about Kumariasava very fondly in terms of the benefit that it gives. And then you superimpose all of those benefits in claim statements given on a product label. And whether it's Mexican authorities, as you say, or it's Canadian authorities, or it's even more stringent authorities, MHRA in the UK or US FDA, or for the matter, the EU Commission dealing with traditional medicines. 100% of those benefit claims that were mentioned in the PowerPoint presentation would not really make the mark. The kind of dossier, the kind of drug master files, the kind of clinical data that one would have to submit as evidence, it's just completely unsurmountable. Second part is that this congregation, even this panel right here and all of our friends on Facebook, haven't really assembled to talk about one product, Kumariasava. We are talking about the entire ethos, the entire public health system of Ayurveda to really graduate itself around the world. Now, when you talk in terms of acceptance of Ayurveda, is it that the Indian government or the Indian businesses involved in Ayurveda or the Indian Ayurveda physicians want to take Ayurveda and establish it in a foreign country? Or that's, of course, one scenario one can imagine, and it's happening. The other scenario is talking about citizens of that country wanting their ethnic medicine. And citizens of that country wanting their ethnic medicine, demanding the right to their ethnic medicine, is a kind of a route that's not yet been tried. And if you do have people of Indian origin in Canada, who, as we have seen in the recent part, farmers protest and stuff like that, the Canadian government is very, very sensitive to the needs and the voices of the Indian diaspora. So if the Indian citizens, whether in UK, whether in Middle East, whether in Singapore, whether in Malaysia, whether in Canada, even in the United States, want their ethnic medicine, they want their ethnic practitioners, then there's a very different wavelength that opens up. Now, mind you, as a comparator, the Chinese community want their ethnic medicine. They want their physicians. They want their physicians to prescribe exactly as if they would do so on mainland. Now, if the Indian community wants their right and access to not only their doctors, but even the entire dispensary that comes with doctors, I believe that's a very different vista of dialogue, government to government, that can open. notwithstanding everything else that Anil Johri talked about quality assurance, everything else that Dr. Ghazala, Dr. Gayatri, or maybe even I would have in other circumstance presented in terms of what a standard operating protocol or GMP can be for even a product like Asavarishtas. Now, this dialogue, when it opens up, the government-to-government discussions that happen, the quality assurance that's backed with almost a third-party certifier, which Ayush Premium really brings about. And kudos to your entire platform, who has, kind of not discussed the mishy-mashy of the entire discussion, but come down to a targeted 75 formulations. So you're talking of 75 drug master files. You're talking of a very fine focus of quality assurance parameters that need to be placed in a dossier, which can be assessed by any regulatory authority. Now, an Ayurveda physician practicing in Canada, practicing Ayurveda medicine in Canada, duly recognized and has a NCISM central registration number, authorized for practice in mainland Canada, for example, or whichever country that the PIO wants to, wants his access, and backed up with medicines that are being exported and would be dispensed and prescribed with this specific prescription. I think this also could be a way that we have not really tried so far. I believe there would be great energy to the government-to-government dialogues that take place. Even the UK-India dialogue would turn on its head the moment that something like this is asked about. So this is the dimension, Dr. Madan, that I add to the entire ferment that we talk on a very, very macro scale.
Thank you, sir. Thank you, Ranjitji, for pulling out this very important point. And I think Anilji is noting these things because, we need to look at it in its fullest. We need to look at all these aspects. Ranjitji, a quick comment from you about this initiative, the WHO initiative in Jamnagar. And can some of these points that you raised and what Anilji has presented and what the longer vision of 75 or 100 or more traditional medicine, can this be introduced into those discussions that will take place in Jamnagar in time to come? Are we in the right direction? Are we looking in the right direction, or do we need to think about it differently? Do you see what I mean? That we want traditional medicines, which is what that center is about. And we want to see how this can benefit people. How can we get new data, which Gayatri-ji is already talking about? She says they are recognizing that we need better data. Can we bring about the dialogue within this kind of community with ongoing dialogues between Canada-India Forum and health networks? Is this something we can, would we be looking in the right direction if we started those kind of discussions?
This is an appeal that I make to almost to all Ayurveda physicians, that yes, we do celebrate Tridosha, we do celebrate the diverse application of basic principle, we do celebrate the individualistic kind of medicine prescription that can really come out of diagnosis, and this is very much the right and latitude of an Ayurveda physician, so that is a given. But this is an appeal that we hone down to some standard operating protocols to manage disorders and disease. And, these standard operating protocols to manage disorder and disease, you may create subgroups in all of them, depending on Prakriti or Avastha or whatever that you can see as the disease, if it's progressed or not. But as I understand, these standard operating protocols, the kind of data that we can gather from the 450 Ayurvedic colleges, each college meets approximately 65,000 patients in OPD every year. the kind of software backbone that you can have where these SOPs are really put into motion, the kind of big data that can be available in a very short time of 2 and 3 years. I think all of this moving towards enablers like the Global Center of Traditional Medicine coming up at Jamnagar, because whatever happens in Jamnagar will echo in 183 countries. So this is a very, very powerful time.
Ranjit, thank you so much for pinpointing this. You remember in 2016 when we gathered in Koblenz for the second European World Ayurveda Congress, we touched on this, but we didn't know that Jamnagar would get a WHO center then, but it's happened now. And I just want to bring in Narendra ji here, just to comment on what Ranjit ji has just offered us here. Narendra ji, please. It's a very, very important point that Ranjit ji has just highlighted here, that we have so many colleges, they have 60,000 opportunities every day to harvest data and to use this. Please.
Every year.
I think I was extremely impressed. So I felt he knocked on the top of my head when we said the demand for Chinese medicine spreads through the Chinese diaspora. It's a very, very important point. I don't have an answer, but the fact of the matter is there was a World Bank report which came out and said India diaspora. When we say diaspora here, it means more than one generation. They don't take counted people to have gone in this generation for more than one generation. So Indians are spread in 98 countries. So it's a unique in the history of mankind. And China, the apple-to-apple example, China is spread in 18 countries. So Chinese more than one generation is in 18 countries. So if they can create that kind of demand for traditional Chinese medicine, if India together, all of us, we are able to create even a fraction of that demand, our acceptance and globalization of this will be in much rapid fashion. I think it's a very, very important point. I think from also the government's point of view, I think we have just started. I think it's probably 7 or 8 years into this Ayurvedic ministry and bringing in the special focus. There is way lot more which can do. I think some pockets of brilliance have already started. This Jamnagar initiative is another shining example. I think slowly over time, we should be able to bring collectively from multiple institutions like Canada India Foundation and yourself, Dr. Madan, in putting together such wonderful intellectual discussion onto this. I think this will lead to some spectacular results. I think we just have to have the belief and keep pursuing this.
Thank you. We look forward to you in Delhi. We are very fortunate to have Ranjit ji, who is engaging for decades, I would say, in this space. And he has seen the change and seen the developments that are, and he is the best person for us to guide us in things like dossiers, and he knows everything. And most of all, we have Anil ji here with us. I'm being highlighted by Harish Verma ji that we are running out of time. But before I draw this discussion to a close, Ranjit ji, a request, if I may, which is September, October is when we have the 9th Global Ayurveda event in Goa. I think this discussion that we are having now about traditional medicines, about Jamnagar, about honing the skills that you're talking about, and some of those related things, I hope we can come all together in Goa to discuss some of these things. I know the second All India Institute of Ayurveda is coming up in Goa. There might be an opportunity to showcase that also in these things. Please.
We have the 9th World Ayurveda Congress happening on 8th, 9th, and 10th, 11th of December 2022 in Panjim, Goa. As you know, Dr. Madan, we have a separate vertical called the International Delegates Assembly. We are very much, and I would be in a deeper discussion with Dr. Harish and some of our panelists right here to see as to what kind of kind of modulation of agenda? What are the kind of tectonic discussions that we want to make? The time, very clearly, things are not going to move as they moved 5 years ago. It's going to be in comparison lightning speed.
Lightning
So
speed. Thank you.
what is the kind of agenda that we bring in? What are the kind of stakeholders that we bring in? Dr. Harish Verma and other physicians around the country would be happy to note that there is going to be a renewed focus of Indian Ayurveda physicians settled abroad and their voice. What is it that they want? Its International Delegates Assembly also includes them. It's not going to be just the foreign interest in Ayurveda. So, I know this has been a kind of not a complaint, but a kind of a dismay in Ayurveda physicians around the world that, they don't really get their voice to something that's actionable. So I believe that this time in Goa, in the International Delegates Assembly, we want to make this kind of difference. I am more than open to look at agendas that we need to drive and bring in the right people in government to ensure that policy also follows. Thank you, Dr.
Gigi,
Madan.
thank you so much for giving us fresh news about what is being planned for Goa. Before I return the floor back to Harish Ji to take our event on, which we've already run over time, but this discussion is so important because we would like people like Satish Thakurji and the Canada-India Forum. Similarly, we now have an Ayush professor in Mauritius. We have an Ayush professor in Riga in Latvia to bring all these people into a dialogue. But before I give the floor back to Harish Ji, I want to just touch on that one point that you mentioned about SOPs. And Anilji is here with us. He knows how to put together the ISO standards for some of these things. And maybe there is an opportunity here that is related to developing, at least catalyzing our Vaidyas, our colleges, our research institutions in India to start thinking about what we need as these standard operating protocols. And I would love to hear just a few words from Anilji before the floor goes back to Harish Verma. Thank you, Anilji.
Well, my complaint is that the education sector has hardly any component of understanding standards and certifications and regulatory approvals and quality all across the sectors. Why only Ayurveda? I mean, I have seen all across the sector that the knowledge base is very, very little in the educational curriculum. So in fact, I have been toying with an idea that a generic course on standards, regulations, because standards means voluntary standards, regulations means compulsory by law. I mean, even this distinction is lost among people and stakeholders and policymakers for that matter. So a generic course on standards, certification, regulatory approvals, etc., probably will benefit all across all sections. So for the people who are leaving to join the industry, maybe.
Anilji, could you just touch I know we are out of time, but this point that you've touched on is very important about standards and regulations. Could you just highlight just a little bit for us?
See, till 1995, we used to use the terms voluntary standards and mandatory standards. But when technical barriers to trade agreement came into being on 1st January 1995, it actually changed the definition. And since WTO agreement is an intergovernmental one, then we need to look at that as the reference point for us, all of us. And it said that standards means voluntary standards. Technical regulations mean, loosely now I'm saying, standards to which compliance is compulsory. So legal requirements, you call them legal requirements or whatever. So this part is also important to understand, that what is voluntary and what is legally required. So we need to educate all over the place. I mean, the stakeholders, the industry, in the education, our students also, as they leave colleges or universities to go to the industry, they ought to know that compliance to Drugs and Cosmetics Act is compulsory. Ayush Mark is voluntary. You may or may not do. You look at the business benefits of going for Ayush Mark. But as far as CDSU is concerned, that's compulsory. You can't live without that. So these are the kind of things which we need to teach.
Thank you. Anuji, thank you so much for now. We are looking to you yourself, and we are looking to Ranjit ji for continued support and input to our platform here running out and hosted by Canada India Forum. So number one, I would like to thank all our speakers today for this amazing event, adding energy to our first event on Triphala. We've discussed Kumari, and thanks to particularly Dr. Bhatt for taking us into those very specific details about protocols and procedures. And thanks to Ranjit ji for pushing the button on standard operating procedures. And it's a very important thing, especially when we have to take this to new cultures. And most of all, thanks to CIF for hosting us, and Narendra ji here with us. Narendra ji, I hope some of the subtleties that we are talking about today will be valuable for shaping discussions in New Delhi. I want to thank Joshi ji for being here with us. Joshi ji, thank you for joining us from London today. And with those few words, the big thanks to everybody here, particularly Ranjit ji, who's at the helm of things, both in terms of the next Global Ayurveda Congress in Goa coming up soon, and how we can shape vibrant outcomes narratives for the future. Thank you so much. Floor is back to Harish ji. Harish ji, namaskar.
Namaskar, Dr. Madan ji.
Apologies for taking a little more time than what you had offered us, but this is a very important, and if we missed this chance, then many things that have come out today wouldn't have been clear. Thank you. So
I'm grateful to everybody. Thank you very much. And now I pass on the floor to Dr. Palvi ji for valedictory remarks. Thank you, and over to Palvi ji. Unmute कर लीजिए. Palvi ji, unmute कर लीजिए.
Okay. Thank you, Dr. Verma ji. I would just like to mention that the first lecture we had on Triphala Churna and this Kumariasava, these two preparations are taken so casually that we don't even realize the importance of how these things can be, with the right adjuvant, can be. If we select the correct adjuvant, we can get the desired result on that ailment or that organ. How Dr. Bhatt and Dr. Ghazala mentioned very nicely, it is a very important medication, Kumariasava, for hepatoprotective, pancreatic, and reproductive diseases, or gynecology and obstetrics. So with this, I would like to thank the Canada India Foundation, the TASTU, and our all the organizers and the participants who are here, Canadian College of Ayurveda and Yoga, Consulate General of Canada, and Consulate General of India in Canada, European Ayurveda Association, Associate Ayurveda Academy, and the dignitaries who are here today, Dr. Venkaten Joshi, Mr. Anil Jowri. You'll have really increased the weightage to our event. And I special thanks to Ranjit ji for coming on this dais at a very short notice, and Dr. Georgie Bhalla, and of course, Dr. Narendra ji, for your very valuable input. I think everybody has contributed immensely to this program today. And I'm happy to see Ritesh Malik, who was with us in the earlier series of these virtual series which took place in the pandemic. And of course, many thanks to Satish Thakurji for supporting us always. So thank you, everybody. And next week, we are coming up with Amrit Arishta. Amrit is Guruchi. It is also called as Tinosporia cardifolia, a very important herb. And with this, I thank the speakers also. And last but not the least, Madanji, for being so prompt and handling and pointing out to very key questions today. Thank you all, and keep participating, and we welcome you to the next session. Thank you.